So welcome everyone to Choose to Take Control. My name is Dawn Rodolini, and I'm the Chief Operating Officer for the National Hemophilia Foundation. I am also the daughter of a man who had hemophilia. I have two children, a 23-year-old son with hemophilia and a 25-year-old daughter that is not a carrier. Next slide, please. So this is our mission, and if you've been joining us lately for educational sessions, you know this slide well, but what I really want to focus on, the part of our mission statement that I love and why I love what I do at NHF, and that is enabling people and families to thrive, because that's really what it's all about for us at NHF, and it's what fires me up every single day. Next slide, please. So let's just see where you're joining us from this evening. So what I'd like to ask you to do is get another device out, a phone, and if you could go to www.menti.com, and then the code is on the screen. So it'll give you a couple of minutes to get your device out. And Kate was great. She just put that right in the chat. That's so much easier than you can just click on it. And you can go to Menti and you can participate because we'll have some interaction with our session tonight. So the other thing is, indicate where you've joined us from. I am in Pittsburgh, Pennsylvania, and I see a couple of people already from Pennsylvania. So that's so cool. You guys should come over. We should do this together. If you don't live in any of these states that are on our map, please type in the chat where you are joining us from, because I know our US territories aren't on here, and we've had some folks from other countries before. So if you'd like to chat, type in the chat where you're at. So let's see. We've got, I think, a corner of Illinois. Is that Arkansas where the blue dot is? If I know my geography.
I like, people are being very precise. I like this, not just the state, like overall, maybe what part of the state you live in. So
I love it. Oh, we got a California. This is great. Well, thank you so much for joining us. I'm excited to have you here. All right, yep, perfect. To the agenda. What are we going to talk about tonight? Oh, such exciting things. Responsibility, accountability. Yeah, I promise it'll be a little bit lighter than that, but really, truly, we are all about educated decision-making, setting your expectations, who's your support network, and then any parting thoughts. So, I told you a little bit of who I am, in the beginning, but I want to share my story and why I think that these things are very important. And it goes back about 23 years ago when I lived in Montana and I had my son, and there is no HTC, no Hemophilia Treatment Center in Montana. There was no chapter back in those days. And we had one pediatric office in the whole town that my son was born in. And when he was diagnosed with hemophilia, they were really afraid to do anything with him. When an injury would occur, we didn't have factor at home until he was 3 years old, because we were not connected with the Hemophilia Treatment Center in the very early days. So I was solely reliant on a local ER who, of course, had their own protocols and completely doubted me when we would come in because I couldn't access his veins. I'd never learned how to do that at that point. And I had to sort of use that knowledge that I had to become his advocate and let them know that infusing him first was the most important thing they could do. And then we would follow any protocol that they had. So I had to learn early on to sort of use that, make them my partner in his care versus being angry and upset when they wouldn't listen to me. So that's why I think that this is one of a really important session to share with you, whether you've been around for a long time or whether you're new to the bleeding disorders community. So next slide, please. So speaking of those early days, in Menti, this is an easy yes, no, but do you remember when you first got diagnosed? And all of those terms, oh my gosh, we use acronyms like crazy in the bleeding disorders community. CDC, NHF, NHLBI, infusion, factor, Specialty pharmacy, who says that, right? Oh gosh, there's so many more. HRSA, I mean, all of these acronyms. So that is a really, diagnosis is a frightening time, especially if you have no family history. But you know what? Even as a daughter of an adult man with hemophilia, it was all new to me. I wasn't going to his appointments with him. And my dad was never seen by a hemophilia treatment center. So I didn't even know this standard of care existed back then. He was seen by a hemonc that agreed to see this guy with hemophilia. And so my introduction to this was really brand new as well. And I couldn't ask my infant son if he was bleeding or if he was just being fussy. And so that was the other part, is the communication piece. So then adding to all of that are these terms that we don't use in day-to-day life. So eventually they become part of your vocabulary. But in those early days, this is all strange days indeed. Next slide, please. So what is responsibility? Let's go back to Merriam-Webster. And I love it when a definition includes the word you're trying to define. So the definition is the quality or state of being responsible. Well, that's so helpful, isn't it? It's really about accountability. It's also about taking ownership of whatever that thing that you're trying to be responsible for. So why are these words important? Well, people with bleeding disorders, if you have access to quality care through the Hemophilia Treatment Center network and a range of effective and safe medication, none of that actually matters if you as an individual do not access these services or that you do not follow your treatment protocol. So that's our responsibility, right? It's to make sure that we are accessing what is available to us. Next slide, please. So accountability. Now, we just used that in the first slide about responsibility, but they really are intertwined. So, it's about taking ownership of your care, because you ultimately are the expert on you, right? So staying informed, knowing the name of your treatment product and what is your dosage, keeping treatment logs. Oh my gosh, I know we're going to actually talk about treatment logs a little bit later. What about medical identification jewelry? And especially knowing your contact information for your health team. I also think that it's about being precise and clear in your expectations and your communications, and really focusing on what you actually need versus what would be nice, so that you can help prioritize what those needs are. And then ultimately you can make those educated decisions. For example, what does your insurance actually cover? Knowing what your treatment regimen is. When you go to someplace like the ER, first and foremost, we have such a variety of kinds of treatments today with hemophilia, but with rare disorders, sometimes they just have never even heard of your rare disorder before. And so instead of being frustrated with that, we need to arm ourselves and be accountable for our own care and know how to advocate. Next slide, please. So knowing what your treatment product is. I mean, what's the purpose of the product? You also need to know that, and be able to explain to someone what is going on. So back in those early days when I was saying that, we had to go to the ER in order to get my son infused, I had to let them know why it was important to infuse first. I had to let them know what was happening in his body and let them know what the minute he was infused, what that would do and how that would help. So emergency rooms have very little experience, as I said, dealing with bleeding disorders. And also sometimes it can take a lot more time, to get your ultimate treatment, right? It might take more than one vial to get your optimal dose. The other thing, think about this. For hemophilia A alone, there are 20 treatment options today. And for hemophilia B, there are 9 treatment options today. When my son was born, there was one that had just come out for hemophilia B, which is what my family has. There was one treatment option, and it was actually came onto the market the year I was pregnant with him. And so that was something that was a new product. Otherwise, there had been some other older products, but that was a huge thing. So number one, don't assume that the person knows what you're talking about, right? And how to use it and how it works. And dosing correctly is really obviously important. So verification, Maysac 188, we'll talk a little bit about Maysac, but Maysac 188 recommends that prescriptions are filled within plus or minus 5 to 10% of the prescribed dose, and that's for factor. Many insurers will follow that policy as well, but does your specialty pharmacy provider, right? Does that person or does that company do that as well? So those are all things that we have to take responsibility for. Next slide, please. So we're going to go back to those early days. For those of you who are newly diagnosed, I know I would have loved to have had that information at that time. And for those of you who have been around for a really long time, you know, this will be a refresher, but not everybody knows the history. So the Hemophilia Treatment Center is a specialized health center that focuses on a comprehensive or a holistic approach to your care. And the HTC brings the team together of doctors and nurses and other health professionals, and really the core team, the doctor, nurse, physical therapist, and social worker. That's the 4 major core parts of that team. Now, every hemophilia treatment center may have other things that they also include, but those are the 4 core providers that come together to treat you as a whole person. And the Hemophilia Network was established in 1975. So it goes back years and years. Originally, the initial grant funding was for 26 institutions, and that was provided by HRSA, another acronym, which is the Health Resources and Services Administration. But that's where our funding comes from for our hemophilia treatment centers across the country. And it was actually started by a center in Los Angeles. They came up with this comprehensive care approach, and they tracked data to see how the impact was on the population that they served, the patients. And so the early evaluation of that hemophilia treatment center program indicated that patients that received care at HTCs had fewer hospital visits, shorter in-person stays, lower costs, and less unemployment. In addition, they proved to have a 40% reduction in morbidity and mortality, death. 40% less patients died when seen by a hemophilia treatment center. So that was huge. And that's really what was established the Hemophilia Treatment Center network that we have today. Next slide, please. So how many HTCs do you think there are now? So go to Menti. I said that they started with 26, but of course, that has changed. 26 isn't even on the slide. So how many hemophilia treatment centers do you think there are across the country? More than 140? Any other answers? 50? Any others? So you guys are right. There are slightly more than 140 hemophilia treatment centers across the country. What incredible growth since 1975. And if I hadn't known this, right, doing this presentation and working at NHF, I would have thought 50 as well, because 26 to 50, you'd think maybe there's one in every state. You know what's crazy? There is still not one in every state, even though there are more than 140 treatment centers across the country. Next slide, please. So a little bit more about hemophilia treatment centers. I already told you, the 4 core members of that team, that multidisciplinary team, are the doctor, nurse, social worker, and physical therapist. It really is this comprehensive physical and psychosocial needs to make sure that those needs of the patients are met. And that's either by clinical staff, or if you don't have, you see all these things here in this little arc. Some hemophilia treatment centers have all of these things: a genetic counselor, an orthopedist, a dentist, a psychologist, all these things. But for every HTC, even if they don't have all of those things in-house, they do use a referral service outside of their scope. So it's really helpful. For our hemophilia treatment center here in Pittsburgh, when my son needed his wisdom teeth pulled, they didn't have that service within the hemophilia treatment center, but were able to refer us to somebody that specialized and had done that procedure for people with bleeding disorders. So it was really helpful to go to somebody knowledgeable. And they're prevention focused, right? And you think, well, we can't prevent bleeding disorders, but we can prevent and reduce the complications that come with bleeding disorders. So that's why. And then it's also focused on patient education. Encourages patient involvement in care. It also encourages a shared decision-making model so that you come to the table together to make your decisions about what's best for you or your child if they are the ones that have the bleeding disorder. Next slide, please. So, by what percentage did research find bleeding complications decreased for those who went to hemophilia treatment centers? I did actually say it in my previous slide. Yeah, very good. Okay, everyone jump on that bandwagon because that is the right answer. Good job. So absolutely 40% reduction in morbidity and mortality. So that was huge. Absolutely. Next slide, please. So you'll hear different terms. Here's another one, 340B. We call it 340B. It just rolls right off the tongue. What is 340B? Well, it's a part of a statute that was in a HRSA grant, and it's called the 340B. It's just the name of that paragraph in that section of the grant. And it's a drug pricing program, which is a federal discount program available to hemophilia treatment centers that receive a HRSA grant. So that human resources organization that funds HTCs, that's the HRSA grant. And Congress established this as part of the Veterans Healthcare Act back in 1992, so that hemophilia treatment centers and other covered entities could stretch their resources and provide more services to patients. So it also allows patients to purchase treatment products from their hemophilia treatment centers that have this program. It's also sometimes referred to as a public health service program, but we typically call it 340B in the community. Next slide, please. So a little bit more about this program. So it allows the hemophilia treatment centers to purchase clotting factor directly from the manufacturer with no middleman in between for outpatient use at a discount for their patients. This means lower factor prices for patients and insurers, and it also can result in increased revenue for the hemophilia treatment center because they can allow a very small markup on this. And that money goes to research specific to bleeding disorders. It has to go specifically to bleeding disorders, and services like outreach clinics, educational programs, and also it helps to support the salaries for nurses, social workers, physical therapists, and genetic counselors. And you might think, well, why do they need that if they're getting this federal grant? Quite honestly, the federal grant does not end up being nearly enough even to pay for one of those staff, but it's really vitally important because it allows them, yes, to have some money, but also to have access to 340B. So it's a really important program. And I'll give you an example. So I've worked with the amazing folks in Denver, Colorado. The Denver, Colorado Hemophilia Treatment Center was our nearest hemophilia treatment center in Montana. They actually used that money to do outreach clinics in Montana. So when Gino, my son, was first diagnosed, and I finally, eventually, when he was about 9 months old, learned that they existed, they actually came to Montana and did a clinic. So we didn't have to fly to Colorado for our comprehensive care clinics. That was huge. When I learned that there was a hemophilia treatment center and that it was only 10 hours away, I know that sounds crazy for those of you who have one in town, but 10 hours away versus not having one at all, that made all the difference in the world. That was a lifeline for us. Next slide, please. So on the other hand, another way to get your treatment products is from a specialty pharmacy. And I know everyone is like, of course I know what a specialty pharmacy is, but maybe you don't, because we have also used the term home care company over the years. But we realize that our payers, the insurance companies, use the term specialty pharmacy. And so it's because of this definition. And we found it really important to use the same language that our payers use so that we are always speaking the same language and talking the same way so that we can get what we really need. So a specialty pharmacy provides medications to treat complex, genetic, rare, and chronic health conditions. And so a specialty pharmacy drug is not available in my local grocery store. You know, in Pittsburgh, Pennsylvania, we have a Giant Eagle and they have a pharmacy. I can't get my treatment there, right? They're not available in retail pharmacies. They also require special storage, handling, delivery, and usually are very high cost. A specialty drug requires reimbursement assistance, often and ongoing patient support and education. Often they're injectable or infused medicines, but it also can include oral medication. And it does require close monitoring of your response, right, in collaboration with a physician, and specific patient dosing. So we know in Factor specifically that we are dosing by not age, not where you live, but it's your weight, right? So as you grow or as you gain pounds during a pandemic, but we're not talking about that here, you might have to use more Factor. So that is something that's really important to be able to do with the specialty pharmacy. Next slide, please. So the other thing that a specialty pharmacy can do is they have access to a specially trained pharmacist. They have assistance verifying insurance and exploring benefit options, assistance in identifying financial assistance options if it's needed, home delivery of medications and all the related ancillary supplies, and home nursing services. Now, one of the things, that's also something that 340B can do too, because that's also a pharmacy. We call it 340B, but it's a pharmacy within the Hemophilia Treatment Center. They can also offer all of these services. Next slide, please. So now we're going to switch to a new term, a new acronym, Maysac. So what do you think Maysac stands for? Is it Medical and Seasonal Advisory Council, Medical and Scientific Advisory Council, or Medication and Scientist Advisory Council? What do you think? Let's see. I feel like we should sing. Da, da, da. That's exactly right. Very good. Next slide, please. Yes, Medical and Scientific Advisory Council. So you guys have been around for a while. I can tell we've got some seasoned vets here in the audience. So our Maysac, and we do call it Maysac, it's a committee of NHF actually, and it was formed in 1954. It's comprised of scientists, physicians, and other treatment professionals and patient representatives who are internationally regarded as experts in the broad field of hematology, hepatitis, HIV/AIDS, and other infectious diseases, and blood safety. So they establish our quality of care guidelines in the United States, but they are world known. So other hemophilia treatment centers all throughout the world actually look at Maysac for those recommendations, and they are able to utilize those in their countries as well. But many other countries also form their own Maysacs. And so it's really a great place for the experts to get together and make recommendations. Next slide, please. So, you know, I had referenced Maysac 188. This is actually quite an old recommendation. It comes from 2008, but it really helped launch us into a better space as far as where you got your treatment and what the expectation was for for the specialty pharmacy providers. And it was huge. It helped guide them in how to treat our community. So the recommendations in this one specifically was, if you were going to be a home care company or a specialty pharmacy provider, that you must have knowledge of clotting factor concentrates and ancillary supplies. So remember, this harkens back to 2008. So that's why there's not other kinds of treatment here, but it's clotting factor concentrates and ancillary supplies. Pharmacy providers should be able to provide the full range of treatment products, including all of the available assay and vial sizes. Their operations, their hours of operations should be really accessible to us as patients. And your process and delivery of your prescription should be filled and delivered within 48 hours. Now, why is this important? I will tell you. So my payer, back in the early days when Gina was very, very young, our insurance company decided to purchase their own pharmacy. They wanted to keep this in-house. And so they went after a small specialty pharmacy that had no experience in bleeding disorders. And the very first time we got our first factor shipment from them, there were no needles in the box, and there was factor. The factor was there, and there was a box of cleaning gloves. And I'll be honest with you, I was a little baffled. And so I instantly was really, really, I got stressed. And I don't know about you guys, but when I get stressed, I also get emotional, and my voice gets high, and I get a little aggressive sounding, and I'm ready to go to battle. And this is all because I'm like, how am I going to get factor in this kid's arm? I have no, the needles that we use, the specific needles that we used, which were the orange Terumo needles, that's what we were trained on, and it's what we trust. And so it was really important for me to be able to have those things in the box. And I also was really baffled by the cleaning gloves. So I actually took a few minutes to calm down. And then I called the company and I asked to speak to our case manager, and she got on the phone, and I said, "Hi, this is Dawn Rodolini. And I just received," I said, "Thank you so much for shipping the factor. I got it, but we're missing a few things, and I have a question." And so as I'm talking, she's actually I can hear on the phone, this is before Zoom, she's really getting upset. And I'm thinking, oh my gosh, I'm trying to be as nice as I can, but I need the needles. And what ended up happening, she'd had a whole day of people yelling at her, of course, because they had no knowledge of bleeding disorders, shipped the wrong things, and people were screaming at her all day. And I finally said, "Wow, it sounds like you've really had a hard day. I'm sorry. Would you be interested in learning more about hemophilia? I could come and do a lunch and learn." And she was eternally grateful. And I did end up going to do that. I talked to them about hemophilia. Now, I'm not saying that's what you have to do. You do not have to go do a lunch and learn, but what you do need to do is make them your partner. I will tell you from that point on, if I ever had any issues, I literally had to get her on the phone or her manager, and they would move heaven and earth for us to get the things that we needed. So we made them a partner. Next slide, please. So here are some other access issues that we've been dealing with today. And when I say today, I mean, in the last couple of years. So we are not going to go into deep detail on these 4 things because, quite frankly, that's a whole session. But it's copay accumulators, copay maximizer programs, alternative funding programs, burdensome utilization management programs. So all of these things are some of the barriers to accessing our medications today. I will tell you, we have a phenomenal public policy and payer relations department that can help you. And please, if you're having these issues, please contact NHF through our handy desk. And Kate is going to put that in the chat, so that if you're having these issues, please email handy@hemophilia.org, and they will be able to get you to the expert at NHF that can help you with this, because this is definitely, these are some of the things that are happening in today that are barriers in our care. Next slide, please. So I'm going to go back to the beginning again. Why treatment logs? So is it just to annoy us and to make us do extra steps, especially when we're super busy? And of course, the bleeds never happen when you want them to happen, which is really never, but always on a holiday, always on a weekend, always whenever, right? It's so important to utilize treatment logs and fill out treatment logs when you're infusing, because they can help identify the signs of a potential bleeding issue. And so, have you ever heard dispensation or utilization logs? Have you ever heard of that language? Well, there's a difference, and we need to know what that is. A dispensation log is not something we fill out. It's something the pharmacy fills out. So this is a report from your hemophilia treatment center or specialty pharmacy about how many units of factor, if that's what you're using as factor, or how many units of another type of treatment product that they're sending you, dispensing to you in a single shipment. A utilization log is what our treatment logs are. This is the report of how much of the treatment that we are actually using, when, how much, and why. And the reason that that is important is it tells the story about whether your product is actually working the way it should be working. And it gives us the information of, gives the payer the information, the insurance company the information, if you needed to add more treatment, if you needed to change a treatment regimen. It shows the proof of why the medical necessity is that sometimes these insurance companies require, if we want to switch to a new product, we want to add something different. And nowadays with emicizumab, or it's also called Hemlibra, you may have to use factor and emicizumab if you're having an active bleed. And so there are reasons for them. They just need to know what is the cause behind you ordering more or outside of the norm. And this can really, really help us to defend the treatment that we need. And it's, you know, you might be thinking that's really frustrating. We have to defend this. But honestly, at the end of the day, that's what accountability and responsibility is. It's on us to help them help us, right? So help me, help you goes back to Jerry Maguire. So this is why treatment logs are so, so important. The other thing is, you know, there are many apps out there that you can use instead of the old paper and pen. But the other thing you can do is snap a picture on your phone. So there are multiple ways you can do that and then share that with your hemophilia treatment center. Next slide, please. So let's go on to medical alerts. Here's a question for you. Yes, no, or not sure. We're making it pretty easy. Do first responders check for tattooed medical alerts? What do you think? Yeah, you're right. They actually don't. And we'll talk about actually why. I did ask this question because there was a time only not so long ago, maybe 4 years ago, 5 years ago, people started tattooing their diagnosis on their arm. And they were like, oh, no, it's totally fine. I've got this right here on my wrist, or I've got this on my arm right here. And then they'll be able to see that. So next slide, please. Let's talk about this. So medical identification. There are many ways to show your medical ID, right? What are the pros and cons of these, right? So there's a wallet card. So the wallet card's literally in your wallet or your purse. A seatbelt strap, for those of you who don't know, oftentimes parents with infants or young children will put that on the car seat, you know, the seatbelt that goes across, and this like this slidey thing that has their medical information on there. A visor card that of course goes under the visor of your on your car, you know, that helps shield the sun. A tattoo, which we just talked about, jewelry, necklace, bracelet, ankle bracelet, and other. So what do you think EMTs look for? Well, let me tell you about each of these. So a wallet card in many states, in fact, most states, it is illegal for an EMT to go into your wallet or your purse to search for any kind of identification. Those laws have been slowly building over the years, but now I think that's most states, they are not allowed to go into your wallet. And that is because of claims of theft, unfortunately, in past accidents or situations. The seatbelt strap, while it's a good identifier, if they're trying to get your infant or your child out or yourself out, the first thing they do is they cut the belt, because their job is to save you and keep you alive. Their job, they do not stop and take the time to read whatever is on there. So their job is to get you out of that vehicle as fast and safely as possible. Visor card, same thing. They're just not going to take the time to read it. And if you're in an automobile accident, there's a good chance that that's either fallen out or is destroyed somehow. The tattoo, certainly they're not taking the time to read all of the I love mom things, or, you know, I loved Jenny, like where you add the D after you break up, those kinds of things. They're not taking the time to read that because obviously it's just too much. There's no way for them to do that in a timely manner to keep you alive. So jewelry, what they are trained to do is literally a sweep. They do this, they feel for your jewelry, they check your necklace, especially on little ones, they check their ankles for jewelry because that's a place that, so they do check for medical alert. And that is the number one way that EMTs have told us this is the way to get them the information that will save your life and get you treatment. And the other thing is the laws are different from state to state. So you need to know the law in your state, excuse me, or if you're traveling, you should know the laws of the state that you're going to. So it's really important for us to know that. Next slide, please. So making educated decisions. Who do you talk to about what your options are? And does your pharmacy provider, does your insurance plan dictate who you get your factor from or your medicine from? What are your pharmacy needs? You should have a list of what those needs are. And do you get your factor or your treatment from specialty pharmacy or 340B? And do you know the difference? Is that even allowed in your insurance company? You have to figure out what those things are. Your treatment options. Who decides whether you do, if you're using factor, prophylaxis or on demand, or if you're using, another kind of treatment product? Who helps you decide that? And then what are your options or your restrictions? So we're constantly, there's new products in the pipeline and coming in the future. We've had new advances, amazing advances over the last couple of years for hemophilia. And also for von Willebrand's. There have been new treatment products for von Willebrand disease. So, these are really decisions that you make with your doctor or your nurse, because our nurses are near and dear to our team. And so these are, when you go to the table, have this information available because you're going to be making shared decision. When we talk about shared decision making, you need to be prepared to say what is really going on and for yourself or for your child. And here's what we'd like to try or do. And here's why. And then that your doctor or nurse can really walk you through these. The manufacturers of these products can give you excellent product information, but they shouldn't be giving you advice on how to treat. Your decision about dosing and treatment options really need to be made with your physician or nurse. And the reason I bring this up, when extended half-life factor came out, I had been at a chapter meeting, which by the way is a phenomenal partner to us as well, are our chapters. And I went to an event and there was a company there, a manufacturer, and I was looking at the new information on a half-life product. And they came over and said, well, our product's half-life too, extended half-life. And I said, oh, I didn't know that. I thought it was a standard half-life product. And they said, no, you just can double dose it. Now, this was a sales rep, right? Not a medical liaison. But again, they're like, yeah, just dose twice as much. Then that way you can use our product too. And it'll stay. Well, that is not accurate. So, you really have to make those decisions with your physician, but gather the information from the manufacturers. They have phenomenal programs and resources, but you want to make that decision ultimately with your healthcare provider. Next slide, please. The other thing that's really important too, and I don't want to forget to say this, take notes. When you go in for your visit, take notes. When you're talking, I actually use my phone because I have the notes section on my phone, and I'll put, even though I think I'm going to remember everything that's said, I never remember everything that's said. And so I will also pause and say, hey, hold on one second. I need to add this to my notes page so that later I can go back and refer to those notes. So when you're choosing an insurance provider, you're thinking, okay, I don't get to choose my insurance provider. It just depends on what insurance you have. You may have Medicaid or Medicare. You might be on private insurance. Your company might provide insurance. There's all kinds of different options out there. So what you need to ask any insurance provider are these questions. And if it were me, I would take a picture of this list if you already don't know these questions. But number one, do you have a list of preferred providers for my treatment? Now, yes, focus on your bleeding disorder, but if you have other comorbidities, if you have other diagnoses, make sure you include them in that conversation and don't only say your bleeding disorder, because you might find that they cover everything for your bleeding disorder, but not for your diabetes or not for your heart, whatever those things are. So make sure that you are inclusive of what's going on. Ask, is my treatment covered under major medical or a prescription plan? Ask if it is under the prescription plan, do I have a separate deductible? Is there a preferred drug list? What tier is my treatment covered under? What's my copay or my co-insurance? And is there a maximum out-of-pocket cost? Is there an annual cap on major medical? Is there any caps on prescriptions? What are my out-of-network benefits if I decide to use a specialty pharmacy that's not a preferred provider? And then what kinds of prior authorization do you require for my treatment? So these are really important questions to be asking anytime, even if you work for a company and you've been using the same insurance provider for a long time and they switch. Make sure you reboot all these questions and ask again. Don't assume that just because you had this before, you'll have it again. Next slide, please. So just to touch base on the support team, I've mentioned some of these folks, throughout the presentation. Certainly your family, your friends, your hemophilia treatment center team, your chapter, I mentioned them, your pharmacy provider, your manufacturer has great information. Your insurance provider, I know we sometimes think of them as maybe a barrier, but they really need to be part of your team, and we have to treat them that way because they can really help us to get the things that we need. And so most of all, though, you are your best advocate and you are your expert. And so making sure when you're communicating to each of these people or these groups, that you're also making sure that you are talking about your needs, that you're advocating for your needs so that they know how to help you. Next slide, please. So what is your team's support role? What do you think? Is it emotional, financial? Is it about treatment decisions, or is it all of the above? I love these little dots. Yep, you're right. All of the above, definitely. Because certainly we all have co-pays, right? We have emotional support, I think, is one of the biggest things. Just knowing you have this team with you and that you're not going this alone, for me was truly life-changing. Treatment decisions, I already talked about that. But I really think talking through with somebody about what treatment decisions that you want to make and what you feel would be best for you, that's a huge thing. But even, with your family, I mean, my family does not know how to infuse. Now, my son's now 23, but when he was little, they did not learn how to infuse. So they really couldn't be a part of that part of my support. But boy, were they there emotionally, right? So think about the members of your team and who you need to be there. Next slide, please. So this is the time for questions. I do not drop off because after we are going to ask you to do an evaluation, but we'll have a drawing for prizes. So, and by the way, just, the little fast talk at the very end, staff and sponsors are not eligible to win. So I'm sorry for that. But what questions do you have? Type them in the chat. We'd love to hear from you if you do have any questions. But as you're thinking of your questions, we can also move to our evaluation. And Kate, I don't know if you have any questions.
Thanks, Dawn. Yeah, this was really helpful. I think you explaining some of the things that we just assume people know and some of the background on the why and how we got here and what does it mean now in today's environment, which is so different. But learning the shared back then, how relevant they are to understand how we got to where we are today. So I think that's really important, information for everybody to have. I also think that, it can be a lot to navigate.
Yeah.
So I think we're always like, be your best self advocate, but sometimes that's like knowing when to ask for help and that it's too much to navigate because, you know, I mean, it can be anything with insurance, right? Or you're switching to your partner's plan instead of your plan, that plan switching, you know, that's happened where I worked at one company, but then they switch their insurance. And so
Yes.
it's like you have to ask all these questions again, read all the fine print, and that can take a lot. So maybe it's not that somebody helps me in this area, but then it's, I need somebody else to make dinner so I can go like research all of this online or do those other things. So I think it's truly thinking about that whole team and just not being afraid to ask the questions. That whole like, there's no stupid question. Go in with that mentality and do it with, like you said, Dawn. I think the best thing was about going in hopes for partnership will bring the best outcomes, you know. So
yeah. And I don't know about you, but when I go in and Rob, I see your questions in the chat and I will definitely get to those. When I go in, I don't know what it is. I literally just had a doctor's appointment last week. I go in and I become the instant pleaser. It drives me crazy that I do it, but they're like, how are you? Great. Everything good? Yes. I instantly forget everything. So before I even go into my appointment, I have been keeping a list of the things that I do want to discuss. And then I'll pull it out. I'll pull out my phone and say, okay, actually I have a list. I needed to ask you about this. Is there an adjustment that I need to make to this? I having a hard time exercising and losing weight. Do you have any recommendations? You know, whatever those things are that, or is this a safe exercise to do? You know, those kinds of things that pop up during the year between your clinic visits. If you're going annually, that's a long time to try to remember things. And that has helped me tremendously. So that's definitely something I recommend. And then when you're in the appointment, I already said that, bring your phone to take notes. Or if you're not a tech person, just bring a little pad and a piece of paper. No, same thing, pad and pen with you and jot down those notes, because I swear you will not remember what they say later. So that's important. So Rob, in answer to your question, which states do not have an HTC, you can actually find the list of hemophilia treatment centers on the CDC website. And it's CDC, oh gosh, is it cdc.gov, Kate? Is that what it is? And it'll show where all the treatment center is. But I know that there's no hemophilia treatment center still in Montana. There's no hemophilia treatment center in Wyoming. And I know that part of the country really well. There are some other places as well. And yes, and some of our territories don't have there. Thank you so much, Kate, for putting that into the chat. So there are other territories too. You know, there is a treatment center in Puerto Rico. There is a treatment center in Guam, but I think I don't know that they are open every single day. I mean, there's certain limited hours because, you know, they have a limited staff. And I even remember back in the, probably now I have to think, now I'm dating myself, but maybe 20 years ago or so, even in Idaho, they were only a part-time center. They were only open a certain amount of days a week. So that's also important to know is what their hours are. But those sites, that site will give you all the contact information for the hemophilia treatment centers around the country. The other question was, is there anything being done to bring hemophilia treatment centers to those states? Yeah, so we have like this regional network, and those regional administrators that help with the grant funding and other hemophilia treatment centers will mentor and help areas without an HTC when they can identify a hospital that will agree to serve as it. And it's not an easy decision to make. It costs several $1 million actually to get one started, because you have to provide the services, right? And then the hospital has to agree before getting the grant money from the feds. They've got to be able to front that money for the staff. So it's actually not as easy. But yes, definitely advocacy happens all the time. Hawaii is a great example. So the region in California helped start the Hawaii Hemophilia Treatment Center because those patients were having to fly, can you imagine, 6 hours one way to go to a hemophilia treatment center visit. So about 15 years ago, the Hemophilia Treatment Center in Hawaii was started. So that's a great example of people coming together and making sure that that happened. And then from Grant, yay, absolutely, Grant. I'm happy that you do appreciate it. It's really important. You guys are all part of our care team, and the experts and the resources that you provide are phenomenal. So thank you. And also for your support of us. So I promised I would, we'll get to the evaluation. So please, please, please fill out the evaluation. Also, I can't see the answer, so you can be totally honest, but of course you need to put this speaker was wholly engaging. No, you don't. You don't have to put that. You really want to give honest feedback. And Kate's like, no, we don't say that. So let us know. You can do this in Menti. And then the next screen, Kate, is, oh yeah, what was your main takeaway from today's presentation? I'd love to know that. That really helps us. And then the final question, it's a short evaluation, is any additional comments? So the results aren't going to be displayed here, but why, what else do you want to see? What did I miss in this presentation? What was there something that you wished I would have covered? Let us know, because it really does help us improve our presentations, and feedback from you, or that's really what this is what it's for. It's for you. So that's why we want to know. And we'll give you a few minutes to fill out the evaluation, but let's go to the last screen. Speaking of our partners in education, we really want to thank you. So Accredo, BioMarin, CSL Behring, Genentech, Hemophilia Alliance, Sanofi Genzyme, Novo Nordisk, Sangamo Therapeutics, Takeda, and Pfizer. Thank you all for being our supporters and sponsors. It really means the world, because without you, we couldn't be doing this. So I really appreciate it. All right, so are people filling out the evaluations, Kate? Can you even tell? Okay.
But I believe it. I'm feeling
okay,
it.
I believe it too.
There's good engagement in the chat, and this group has been active, so I love it. So please do help us with that feedback. And this series, tonight is night one of a multi-part series that are really, it's meant to build on each other. So we're really hopeful that you will join us again next week on Tuesday, same time, for taking the same conversation to the next level around some of the other things to navigate, as you're a member of this community, and what to consider when you do have these conversations or have interactions with various different types of partners. So that feedback that you guys share will make sure that we're including all of the right stuff in that one as well.
Awesome.
And yep.
Yeah, talk about instant change.
Yes.
I love it.